Dear colleagues and participants of this conference, my input into this panel is based on the Evidence for Better Lives study. Evidence for Better Lives aims to conduct a birth cohort study of around 12,000 newborn children born in middle-income countries. Over the past 4 years, we've realized a foundational study. This study aims to identify the challenges and the opportunities for such a project. Evidence for Better Lives is a collaboration of 13 universities in 4 different continents. In each participating country, the study sites are medium-sized cities. This includes Jamaica, Ghana, South Africa, Romania, Pakistan, Sri Lanka, Vietnam, and the Philippines. For the foundational research, we recruited 150 pregnant women in each study site. To date, we conducted a baseline survey, collected biological data, realized a second wave after birth, and a third wave during COVID when the children were about 24 to 30 months old. Conducting such a study was a rich experience. But what has it taught us about the challenges and opportunities of going to scale? I want to highlight 5 main issues that may be relevant for our discussion. You can find more detail in a report that you can access on our website. EBLS is designed to contribute to the UN Sustainable Development Goals around child well-being and the reduction of violence against children. This raises an important question. Should we plan a poor observational study, or should there be an intervention component? There is no easy answer, but funders, stakeholders, and the discussions in the consortium have made it clear that there is a huge interest in going beyond mere observation. Our tentative conclusion, therefore, is that we should plan for an intervention, despite all the massive logistic and financial challenges. Coordinating a multicentric study, you will not be surprised to hear, turned out not to be a trivial task. We learned a lot about how to manage such a study, but I want to highlight one issue relating to governance. Our contractual arrangement followed a hub and spokes model. This establishes transparent lines of accountability and responsibility, but it is not necessarily adequate for achieving equal partnership and joint ownership of the project at all levels. Continuous consultation and discussions on Zoom across 13 time zones have started to overcome this hub and spikes thinking, but we need to go further towards a network of responsibilities, where one group has expertise for database management, while another group may coordinate capacity development. Integrated data management has been another important challenge. In the foundational study, the data capture process was coordinated via Qualtrics, while the management of the personal identifiable data and the scheduling process was done by each team locally. This was not ideal. It led to a lack of oversight over the process. We have concluded that larger study would need to find an integrated solution across all aspects of data management, like supported by a specialist software such as RedCap. Equivalent of measurement across cultures was another major concern. Translate and transport into different cultures is the standard approach. However, we found that widely used instruments don't always show acceptable equivalence across study sites. For example, the analysis of the patient health questionnaire suggests that antenatal depressive symptoms manifest differently across the contexts included in this study. This is potentially highly consequential, and our conclusion to date is that a translate and transport approach is not sufficient to realize a high-quality comparative longitudinal study, and that several of the instruments will require adaptation. Finally, finding ways to develop the research capacity for all members of the consortium was an important goal. The most exciting initiative probably was the EBLS Early Career Network. It includes 30 members across the study sites. During COVID-related lockdowns, we developed bi-weekly training workshops for early career researchers. Sessions included training in research methods and writing skills, and early career researchers are encouraged to work together on analyses and publications. To date, the Early Career Network has resulted in 3 master's theses and 3 dissertations, amongst others. 13 out of the 14 publications related to EBLS have been led by early career researchers. And I conclude by showing you this very optimistic and very encouraging picture of some of the members of our early career network. Thank you very much.